Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the lumbar spine. It is the Multifidus lift test. Now this test came from a paper in 2013 in which the researchers were wanting to develop a test to determine if there is a dysfunction in the lumbar multifidi muscles, because they were saying, well, you know, low back pain can come from a dysfunction of these muscles. So what they did, they performed ultrasound imaging of the multifidi to see when they were relaxed, and when they performed this test to see if they actually move. So they developed this test from that, which we are going to demonstrate for you right now. To perform this test, you have them laying on their stomach just like so. You want their arms over their head, so flexed to about 120 degrees with the elbows at 90. Now, in the original article, they looked at L4, L5, and L5, S1. So we want to find those segments. So as we know, we can go here on the iliac crest, come together. We should be right around the L4 segment. So once you find that spinous process, they said to sink over just slightly, and you should be just lateral to it, and you should be on top of that multifidi muscle. And then you palpate it. Then what you do, you ask them to raise the contralateral arm. So as they raise that arm up, you should feel that muscle pop into your finger. So the positive, or how to rate it, is subjective. So they said it's a good contraction if it is very crisp and it just pops up into it, or if it's delayed, there could be dysfunction. So it is pretty subjective in how you measure this test. And then all you do is you go to the other side and you do the same thing. And they looked at the, like I said, L4, L5, and then L5, S1. So that is how to perform the test. And getting into the research for this test, like I say so often, there's not a whole lot out there. So there's nothing I could find on the sensitivity, specificity, or anything like that. But in the original paper, it is said that it has very good inter-rater reliability, but they only had two examiners that were performing this test when they were doing that paper. There is another paper that's pretty interesting, because in this test they're saying that you are only testing the multifidi. And in this paper, they wanted to see, do you get any other muscles turning on, especially the erector spinae? So they did surface EMG and intramuscular EMG, and they found when you perform this test that you actually do get some erector spinae contraction on it as well. So there you go. So take that how it is. So that is the Multifidus lift test. Let us know, do you use this test? Do you like it? Do you think we need to do some more research on it? Let us know down in the comments below. And as always, take care of yourself. Take care of your patients. We'll see you then.